Hello everyone, myself Priya Vishnoi and my team members are Damini, Kanishk, Piyush and Kunur. Our mentor is Dr. Nupur ma'am. We are MBBS students of batch 2021 and 2022 from Shri Balaji Institute of Medical Sciences. Our topic is landmark guided central line insertion. There are three possible sites for central line insertion in adult patients, namely internal jugular vein, femoral vein and subclavian vein. Right internal jugular vein and right subclavian vein are most direct path to right atrium via superior vena cava. Central venous catheter is a form of venous access. It is often needed in critically ill patients and in those requiring prolonged intravenous therapies for more reliable vascular access. This is a simulation model of landmark guided central line insertion via subclavian vein. Now I will demonstrate the procedure to you. Firstly, we'll put our middle finger in sternal notch as aiming point and thumb in deltopectoral depression next to clavicle where it curves, that is between medial one third and middle one third. This is the deltopectoral depression. Thumb rests against clavicle. Skin puncture site is just behind thumb, that is 1.5 centimeter from clavicle. First step is to pierce the skin but not deeper, so we'll take the needle and the syringe. We will advance at a 30 degree to 40 degree to achieve this needle and advance to contact the clavicle and establish thumb tracks, needle tip and shaft by palpation. Now we'll pull back slightly to disengage tip from periclavicular connective tissue and depress syringe needle as a unit below depth of clavicle. Now I'm pushing the tip of the needle down. I'm pulling back on the syringe with the right hand and then I'm just advancing under the clavicle in a straight line toward the sternal notch as a aiming point. We'll maintain the gentle aspiration on plunge. We'll maintain the gentle aspiration on plunge so as to know that it hasn't punctured the vein yet. Vein puncture will be signaled by aspiration of blood. Vein puncture is signaled by aspiration of blood in the syringe and we will take the syringe off. Now we will reposition our left hand and firmly grasp the needle hub and anchor the needle hub. When blood freely aspirate in the syringe, we will remove the syringe and immediately insert J-shaped guide wire. Now we are, as you can see, now we are inserting J-shaped guide wire. This wire should pass easily. Then we will keep holding this wire. And when this wire have then we will keep holding this wire and remove the needle. We'll make sure that this wire stay in the vein. After it, we'll use a scalpel to make a minute puncture of approx 3 millimeter in the skin so that we can now pass the dilator over the wire and gently and firmly dilate the track. So now we'll pass the dilator. I'll show you. This is the dilator. As you can see, now I am passing the dilator over the wire gently and firmly over this J-shaped wire guide. along the track so that our central line can easily enter the vein. Now we will remove the dilator. We'll keep holding this wire in its place. Now this is the central line. This is a triple lumen central line. We'll keep holding this wire. Then we'll add this central line's lumen in the wire, over the wire, and track. Now we will pass the central line over this guide wire. This is a central line catheter. It has triple lumen, in which this is the proximal one, which has 18 gauge. This is the distal one, which has 16 gauge, and this is the medial one. It also has 18 gauge. Now we will pass it over the guide wire so that it can enter the vein. Now you can see that I am inserting this central line. Once this central line has been inserted, then we will remove the guide wire. Now we will remove the guide wire. And apply lumen clamp. Usually we need to aspirate the blood present in this triple lumen, and then we will apply lumen clamp, lumen lock. And then we will ensure that the catheter position is not moving and it is in its proper place. So we'll ensure its position, and then we'll suture it so that we can easily see the point where the insertion has been made. Then we will suture these points so that it remains in its place, and we can also see correctly the insertion site. We should always take consent with patient or patient's guardian before performing central line placement, because it has some major complications associated with it, such as infections, bleeding, arterial puncture, hematoma, hemothorax, pneumothorax, thrombosis, and even procedure failure.